My name is Tyrell Gray, and I'm currently doing my Master's in Sports and Exercise Medicine. And today, I will be examining the hip joint. Today, we have a patient here. Can you please tell us your name, your age, and what sport you are engaging?
Good day everyone, my name is Nikosi Koshi. I'm 21 of age right now and I play soccer, also known as football.
Okay, thank you very much. Nice to meet you, Nikosi Koshi. Basically today, with our examination of the hip, we are going to do some observation of the hip. We are going to do some range of motion, right? We are going to do some palpating, and we're going to do some special testing, right? So the hip joint is connected from the lower limb to the hip bone, right? So today, can you stand for me, Nikosi? Right, so I'd like you to please remove your top, right? Basically, with him removing his top, right, you will be able to see the alignment of the hip properly, right? Right. So just come right here for me, right? Right. So we are looking at the hip joint, right? We are looking to see if there's any swelling, any tiltness. Turn for me, right? Turn again. We are looking to see if there's any bruises. Turn again for me. One more time. Right, nice. So we are going to allow Mr. Koshi to walk to the end of the room and come back. Turn. One more time. Right, we are looking at the symmetry, right, the alignment. Right, if there is any, one more time, if there is any hopping in his walk or any limping. All right, thank you very much. So, have a seat. Right, so now we are going to do some simple palpating, right? Mr. Koshi, I'd like you to go up onto the bed in a supine position. Right? So we are going to do some simple palpating, right? We are going to feel to see if there's any warmness in the hip, right? And we are going to palpate the frontal part of the hip, right? To see to feel if there's any stiffness. Nice. All right. So now we are going to do some range of motion, right? So we are going to ask Mr. Koshi, right? You're going to raise your right, bring your right foot to your chest for me, right? Drop it. Next one. Drop it. Right, so we're just looking at the hip to see what will happen when he does that movement. Now I'm going to do the movement for you, Mr. Koshi. All right, so when I'm pushing, you're going to tell me if you're feeling any pain, any discomfort. Right?
No pain.
So you win again.
No pain. No pain.
Win again.
No pain.
Right. So now we're going to do some abduction and adduction. Any pain?
No pain. No pain.
Right. So now we are going to do some rotation of the hip, right? So So we are going to do that internal and external rotation of the hip.
No pain.
Pain?
No pain.
Right. So you're going to take your both knees, right? You're going to bring it to your chest again for me. Up. Right, you're going to hold here for me. Right? You're going to drop the right leg. Drop your right leg. Any pain?
No pain.
You're going to bring it back up. Drop your left leg. Any pain?
No pain.
Bring it back up. Right, hold. Drop both legs. Any pain?
No pain.
Nice. Okay. Right, you're going to turn in a supine position on your stomach. Right, you're going to turn over. And you're going to lift. Here for me, you're going to do an extension of the hip. Right? So I'm holding the hip. Any pain?
No pain.
Let's go again. Next leg. Up.
No pain.
Nice. Okay. So you're going to turn over. Right? Can we raise up? Right. So that's just some range of motion exercises that we did. Right? So now we're going to do some specific testing. Right? So you're going to stand for me. Turn. Right, you're going to place your hands in mine. Right? And you're going to raise the right leg. You're going to stand on one leg. Right? So what basically we are doing here is looking for any drop in the hip. So once there is a drop in the hip, then we will know that there is a positive test here. Right? So there we go. Alright, next leg. Nice. One more time. There we go again. Alright. Nice. So you can actually see there is no dropping of the hip. So this is going to be a negative test. Right? So now we're going to do something that you call the Thomas test. So you have a seat at the edge of the bed. Nice. Right. So you're going to put your hand around your left, behind the left knee. Right? Both hands. Right? You're going to lie back. Raise it. Right? So what we're looking for is for the flexion of the hip. Right? So basically the leg is being left right hanging. So once the leg would have been like this, then we'll have known that there is some sort of pain or some sort of tenderness going on in the hip there. Right? So we're going again. You'll be doing it on the other side. So we're looking for the same thing. And as we can see, we are not seeing any form of extension there, right? So that's good. So wait for Mr. Question. Right. And that's the end of my hip examination. So from just a summary, right, from examining Mr. Koshi, we can clearly see that his alignment is good, his symmetry is good, right? There is no sort of pain on the palpating, there's no swelling, right? There's no tenderness. So as we can see, Mr. Koshi hip examination was perfectly okay. And that's the end of my presentation.